Why do I do private surgery? I mean, you know, the money has to come into it. I mean, people aren't stupid. You know, I do get money for working privately, and I do get more money than if I work in the NHS. And I've done an awful lot of training, and I've worked really, really hard, and I constantly update myself and keep my surgical skills and knowledge up to date. So I work really hard to make sure that I give people value for money. So money is a big part of it. But also the private care is just a bit of a better business class service. In an ideal world, the NHS would be able to deliver that sort of service. But with capacity and resources, it's very, very difficult to do that. We only have finite resources within the NHS, and that means that you have fast throughput clinics, and sometimes you're dealt with different people. You can't see the same person each time, and that can frustrate people. And obviously, weights and things like that. You know, there are significant weights within the NHS, where privately there is no weight. So the service I deliver privately is the service that I really like, because that is my gold standard service. Spend plenty of time with the patient, think about them a little bit more, do more calculations and be a lot clever about them, and then really give a bespoke rather than a generic level of care. And don't get me wrong, the generic level of care is still a fantastic level of care. We do our best for you. But it's just when you do the private stuff, there's a lot more scope to do different things. And also the post-operative follow-up and post-operative issues. You know, we look after each patient the same, and it makes no difference if you're private or NHS, because you get the same post-operative care, but the capacity issues are a lot less in private care, so we can see people sooner and see people faster. And if they need the input because something doesn't go to plan, you can give it to them a lot more easily. And so, you know, I just think it's a business class service, and that's what I always like to deliver from the very start to the finish. You just get a bit more flexibility, and you deliver the care that I'd want my parents to get. You know, and I always think like that. You know, if my parents were going to have cataract surgery or lens extraction surgery, then what service would they get? And that is the service that they get within the private sector. And it should be available to everybody, but sadly we don't have the resources for it. So yeah, that's why I do private care, more flexibility, able to offer patients more, able to offer patients not quite better care, but expanded care than I can for my NHS patients, with more choices, better access to surgery and times and things like that, better access to lenses, and it just makes me feel good because I'm doing the very best for them. Whereas the NHS is more restricted, I still do the very, very best for them, and actually surgery-wise, you know, you still do your very best for every patient, and every surgeon does that, not just me. Whether you're private or NHS, when you're sitting at the operating table, you give 100% to every single patient from start to finish, so that doesn't make any difference. It's the bit around the side that you can do a little bit more with private. And again, you know, money is important. I've done a lot of work to get where I am, and you know, sometimes you pay for what you get. And you know, I really think my skills are great, and so people pay for it, and that keeps me and my family comfortable. And you know, you can't get away from that, but you shouldn't shy away from that either. And so, but it's part and parcel of all of that. The reward in helping people is actually probably the highest thing, and then obviously money does come into it.